So at first, and I'm sure many of you who are Chinese medicine practitioners recognize these differential diagnoses because this is what you learned the first week in differential diagnosis class in Chinese medicine. You learned all about hepatitis. But what you learned is you learned about acute hepatitis primarily. And so you heard that the liver, gallbladder, damp heat is the predominant way in which hepatitis manifests. Well, we're talking about acute hepatitis here. It can also continue over the course of time. However, we have a bright yellow face and eyes, jaundice basically, fever, costal pain, nausea. These are associated with acute hepatitis, whether it's acute hepatitis A or acute hepatitis B, and sometimes acute hepatitis C, although much more rarely. The pulse in this case can be wiry and or slippery depending on whether there's more dampness or more liver gallbladder involvement. And the tongue can be red with yellow greasy fur. Now that's to be differentiated to some degree from spleen damp heat, where there is a bright yellow face. It's a type of jaundice, but it looks different, with abdominal pain, nausea, fevers, and of course decreased appetite associated with the nausea. The pulse can be slippery and fast, and the tongue is often red with a yellow greasy fur. So these are still in the acute stages. And then here's another kind of acute disease, which can be spleen damp cold, where there's a sallow yellow face. It looks kind of different because there's coldness involved. Abdominal pain, nausea. A person feels cold despite having a fever, a decreased appetite. And in this case, the differential pulse is not necessarily slippery, but tight, which is associated with cold pain. So one of the things I want you to notice here is when we're talking about these differential diagnoses, I'm putting them specifically towards liver disease here. And because you can have these differential diagnoses with other signs and symptoms, but I'm specifically talking about the liver symptoms here. And then the tongue would be pale in this case with a greasy white fur, and that's your differential diagnosis in the acute hepatitis C diagnoses. Then there is continuing to be another excess syndrome, which is very common and is generally associated with chronic hepatitis, however, is qi stagnation. And I know all of you know about qi stagnation, that there's fatigue, there can be costal pain, there can be fullness in the abdomen, nausea. These are all things associated with qi stagnation. And of course, flatulence and bloating. I mean, these are very common signs that people come into the clinic with on a regular basis who have not necessarily just have hepatitis C, but often people who have liver disease. In this case, there can be, we have a Western diagnosis here of often elevated liver enzymes. There can be a swollen liver, a swollen spleen. So we have splenomegaly and hepatomegaly. The pulse is wiry, so there's a pulse of excess here, a wiry pulse, a pulse of stagnation of the liver qi. And the tongue can be purplish, or it can also be normal with a thin white coat. Not necessarily a lot of blue veins, because that's associated with more with blood stagnation, with shui stagnation. And continuing on with spleen qi deficiency, fatigue. It's a predominant form of a predominant part of diagnosis. Abdominal tenderness, not necessarily so much pain and fullness, but more tenderness. So somebody touches their abdomen, it feels kind of tender, and it also feels good to palpate it. So with spleen qi deficiency, the palpation feels good. It feels nice to put the warmth on the belly. There can be nausea, but more kind of person says that they feel queasy or just not right when they eat, or after they eat, they feel kind of weird. So that's what people describe. And also there can be a lack of appetite or a lowered appetite. And interestingly enough, especially in liver disease, often people feel like their muscles have become weaker. They have loose stools oftentimes. And then the pulse is a pulse of deficiency, a weak pulse, deficient pulse. And the tongue can be pale and swollen. It can have tooth marks, can have scallops on the sides. And what's interesting about this is oftentimes liver qi stagnation and spleen qi deficiency with dampness are very much a part of many people's patterns and differential diagnosis in hepatitis C specifically. And we see this really, really common. I see oftentimes people who come into the clinic who have spleen qi deficiency with dampness as their predominant diagnosis, and they may have a thin, weak, deficient pulse that has some wiry quality. And some people may consider that a contradiction, and it's really not. It's got both things are going on at the same time. And it's not necessarily a liver invading spleen kind of situation. It's often that the spleen is very deficient and the liver is also stagnant. So you have a combination of things going on at the same time.